and on the back of the mastoid process. Splenius assists in rotating the head toward the same side. This muscle besides splenius is levator scapulae, which is shown in volume 1 of this atlas. Lastly, we'll add trapezius to the picture. Here's trapezius. Trapezius is a large and complex muscle. As shown in volume 1, its lower part extends all the way down to T12. Here we're concerned only with its upper part. The upper part of trapezius arises from the medial part of the superior nuchal line and from the nuchal ligament. Its fibers fan out downward and laterally to insert on the spine of the scapula, the acromion, and the lateral third of the clavicle. The trapezius muscles largely define the shape and outline of the neck, both from behind, here are the two trapezius muscles, and from in front. This is trapezius again. Trapezius is thought of mainly as a shoulder muscle. Its upper part raises the scapula. In addition, when the scapula is held steady by the action of other muscles, trapezius acts in the same way as semispinalis, in extending the head and in keeping the head upright when we lean forward. The last muscle to add to our picture is the sternocleidomastoid. Here it is. It arises from here on the mastoid process and just behind it. The sternocleidomastoid muscle runs downwards, forwards, and medially to insert partly on the medial end of the clavicle and partly on the manubrium. Contraction of one sternocleidomastoid muscle produces rotation of the head toward the opposite side. Contraction of both sternocleidomastoids together produces flexion of the head and cervical spine. When we're leaning backwards, their tonic action prevents gravity from extending the head and neck. The tendons of insertion of the two sternocleidomastoid muscles, together with the medial ends of the clavicles, define this hollow in the lower part of the neck. Now we've seen the principal muscles that produce movements of the head and neck. Let's review the muscles that we've seen. Here's rectus capitis minor and major, and obliquus capitis inferior and superior. Here's longus capitis and longus cervicis. Here are the scalene muscles, anterior, middle, and posterior. Here's semispinalis, splenius, and trapezius. And here's the sternocleidomastoid. That brings us to the end of this section on support and movement of the head. In this section, we'll look at the bones of the facial skeleton and the part of the skull the facial skeleton is attached to, the base of the cranium. Understanding the bony anatomy of this region will give us a good foundation for understanding some large and important areas of the head and neck. We'll begin by taking an all-around look at the main bony features of the region. Then we'll look at the individual named bones that make up the facial skeleton and the base of the cranium. Lastly, we'll look at the openings in the base of the cranium which some important nerves and blood vessels pass through. The facial skeleton consists of a number of named bones. We'll look at them individually later in this section, but we'll start by looking at the main overall features of the facial skeleton. To simplify the picture, we'll remove the mandible. The cavity for the eye is called the orbital cavity. It's protected on the outside by the thickened orbital margin. The opening for the nose leads to the right and left nasal cavities, which are separated by the nasal septum. The upper jaw, or maxilla, bears the upper teeth. The prominence of the cheekbone leads back to this bony arch, the zygomatic arch. The deepening hollow here is the temporal fossa. It's enclosed by this ridge, the temporal line, by the lateral orbital margin, and by the zygomatic arch. The temporal fossa contains the large temporalis muscle. The temporal fossa is continuous with this deeper hollow, the infratemporal fossa. The walls of the infratemporal fossa are formed by this part of the base of the skull and by the posterior part of the maxilla. The infratemporal fossa contains the pterygoid muscles and also this part of the mandible, the coronoid process. On the underside of the skull, we come to structures that we've seen already. Here's the foramen magnum, the basilar part of the occipital bone, and the petrous part of the temporal bone. Two thin sheets of bone project down from the base of the skull behind the maxilla. They're the pterygoid plates, lateral and medial. Between the two medial pterygoid plates are the posterior openings of the nasal cavities, the posterior nares, or choanae. The hard palate forms the roof of the mouth and the floor of the nasal cavities. Here inside the nasal cavities are the conchae, or turbinate bones. We'll look inside the nasal cavity in the next section. The posterior nares open into the nasopharynx, which lies in the space between the medial pterygoid plates, the base of the occiput, and the anterior arch of the atlas vertebra. In a minute, we'll look at the individual named bones that form the facial skeleton. Before we do that, we need to take a look at some of the features of the inside of the skull. This special skull has been cut away at a series of levels that are just above the floor of the cranium. The way it's been cut reflects the fact that there are two big steps in the floor of the cranium, formed by the sphenoid ridges and the petrous temporal bones. These divide the floor of the cranial cavity into three parts: the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. We saw the posterior cranial fossa in the previous section. In this section, we'll look at the main features of the anterior and middle cranial fossae. The bone that forms this upward bulge in the floor of the anterior fossa is the same bone that forms the roof of the orbit. This crest in the midline is called the crista galli. On either side of it is a depression, the base of which is formed by these small areas of thin perforated bone, the cribriform plates. The cribriform plate forms the very narrow roof of the nasal cavity. Here we can see it from below. The filaments of the olfactory nerve, which transmits the sense of smell, pass through the openings in the cribriform plate. This flat area behind the cribriform plates is the roof of a cavity that we'll see later, the sphenoid sinus. Now we'll move back to the middle cranial fossa. The bone that forms the side wall and floor of the middle cranial fossa also forms, on the outside of the skull, the wall of the temporal fossa and of the infratemporal fossa. We've seen that this is the roof of the orbit. The bone that forms the anterior wall of the middle temporal fossa also forms part of the orbit. It forms this posterior part of the lateral orbital wall. This complicated raised area in the middle is called the sella turcica.